Let's tell you about the guest we're about to speak to. Of course, we gave him our entire show a week ago Monday. We played and reacted to a recent presentation he gave about COVID-19 and the vaccines. The amount of reaction we got to that was tremendous from all over the country. But I have here his biography from USC, and one of the top private universities in America. And in the recognition paragraph, here's what it says. Dr. Peter McCullough received the International Vicenza Award for Critical Care Nephrology for his outstanding work and contribution in the area of cardiorenal syndromes. He has also been a recipient of the Simon Dack Award from the American College of Cardiology, and his works have appeared in the New England Journal of Medicine, Journal of the American Medical Association, and other prestigious journals worldwide. He has been an invited lecturer at the New York Academy of Sciences, the National Institutes of Health, the U.S. Food and Drug Administration, the European Medicines Agency, and the U.S. Congressional Oversight Panel. As we said last week when we played his presentation, he was considered one of the preeminent and most respected experts in this field prior to COVID. And now, of course, because he's maintained the same standards of scientific excellence post-COVID, they want to cancel him. Thankfully, though, that gives us an opportunity to speak with him now here on the show. And Dr. McCullough, first of all, thank you on behalf of millions of people around the country for refusing to back down and taking a stand and trying to save lives. We just appreciate you and everything you've done. In fact, we're interrupting you right now as you're caring for patients. So we're going to try to take up the least amount of your time as we possibly can. Thank you for joining us.
Thanks, Steve. Thanks for having me. I'm actually at home, but I'm taking telemedicine calls today. And it's the new medicine of doing telemedicine is as busy as it's ever been in the office.
Well, we have 6 questions, Peter, that our audience needs to get answers to. And there's nobody better to ask these questions of than you, okay? So let's start with sort of a big picture question. Who should be getting vaccinated for COVID right now?
I can tell you as an internist and cardiologist, I practice medicine, take care of patients every day. And like you, Steve, I'm a University of Michigan graduate. I went to the University of Michigan School of Public Health. Every doctor and every patient together weigh out the risks and benefits of every medical intervention, including vaccination. And when the vaccines came out of the clinical trials, the COVID-19 vaccines, the FDA and the vaccine manufacturers agreed, and the human ethics committees agreed, that COVID recovered patients, suspected COVID recovered patients, those with positive antibody tests, pregnant women and women of childbearing potential, all would be excluded from getting the COVID-19 vaccines, as well as those with severe immune compromise. And so I follow the clinical trials strictly, and I would never recommend or utilize a drug that wasn't tested in clinical trials, placebo-controlled clinical trials, in a patient with a brand new product. And so at this point in time, I've been in general not recommending or supporting the COVID-19 vaccines for patients once it became clear that the safety of the vaccines was not what we thought it was. And about 70% of my patients took the vaccines in December, January, and February, and March. By the time we got to April, the U.S. rates of vaccination started to plummet because we saw concerning safety signals for mortality, hospitalizations, and permanent injury after the COVID-19 vaccines.
So are you not recommending that any of your patients get this vaccine then at the moment?
At this point in time, we have even worsening data, Steve, that the vaccines are not working fully in individuals. So our CDC, as of October 12th, has told America that there are over 30,000 Americans who have been fully vaccinated who have either hospitalized or died, and of that composite, 23% are deaths. And sadly, 87% of the deaths and 67% of the hospitalizations are in those over age 65. Most of my patients are over age 65. And at this point in time, the vaccines appear to be failing against the Delta variant. And again, the safety concerns are astronomical. We have over 16,000 deaths after the vaccines, 250,000 hospitalizations, urgent care visits, and office visits, and sadly, over 20,000 Americans permanently disabled after the vaccines. So I'll take the next vaccine question on a case-by-case basis. But right now, I don't think any doctors in my circles can give a full-throated recommendation for them.
All right, question 2. What is the benign explanation, doctor, for this zealous desire to pounce on, discredit, or if that doesn't work, just flat out totally ignore absolutely anything that shows any promise whatsoever for a potential early treatment for COVID? What's the benign explanation for this?
I think the benign explanation is just a strong preference by the stakeholders, the CDC, the NIH, the FDA, and the White House task forces of 2 administrations now, the strong preference for a vaccine-only strategy to manage the pandemic. And when I mean vaccine only, meaning that's really the only thing the government is going to strongly support to handle the pandemic.
Why? What's the benign explanation for that?
Well, I mean, you'd have to ask them. I mean, it was obvious Operation Warp Speed was a massive investment of development investment as well as commercialization investment. And now we've had nearly a year of the public program. Private offices aren't administering the vaccines. The vaccines are not sold as a commercial product. They're offered in vaccination centers, which have been largely empty since April. People have been very reluctant to take the vaccine once the data on death and injuries came out. And it's simply been a one-horse show. Take the vaccine as the only suggested action for COVID-19.
Question 3. Along those same lines, what is the benign explanation for the wanton or willful disregard / ignoring of natural immunity? There's a study out, official study actually from this morning from the UK, a government study that found at the very least natural immunity was at least as effective over there as vaccinated immunity and maybe lasted longer because of the waning efficacy of the vaccines. What is it that's going on in our medical culture and government that there just is either no acknowledgement of this or they want to disregard it?
I disagree with those findings of that study. My interpretation of the data is that SARS-CoV-2 or COVID-19 has immunity very similar to SARS-1, which is permanent and complete immunity, just like chickenpox and mumps. Well, once we get these illnesses, we don't get them a second time. So I think there's a negligible risk. The only thing that's out there that's confusing people is the false positive PCR. People, once they have COVID-19, they can intermittently test positive on the PCR test for months afterwards. I've had some patients test positive 17 times. They don't have 17 cases of COVID. They just had 1 case of COVID. So I think the immunity is basically permanent. It's a one and done phenomenon. And so, of course, with that scenario, it's infinitely better than the vaccines. The vaccines have had wholesale failure in Israel, as an example. The Israeli Health Ministry has Pfizer, even with boosters, at 39% effective. So does the Mayo Clinic. They had 42% for Pfizer protection against hospitalization and death. Moderna's a little better, over 70%. But the vaccines have largely failed compared to natural immunity. I mentioned the CDC having 30,000 well-documented vaccine failures, 30,000 in the hospital or died. They don't have a single well-documented case of natural immunity failure, not a single case.
Then why do they want to deny natural immunity, Dr. McCullough? Why?
The denial of natural immunity is a method to get the entire population vaccinated, and that seems like a strong desire. So if they accepted natural immunity, then there would be a giant fraction of people who would never take the vaccine. In the paper by Block and colleagues in the British Medical Journal, September 17th, by May, we had 120 million people who have already had COVID-19, 44% of those age 18 to 49. So if we follow natural immunity, that means a large segment of America never takes the vaccine. What it means now, since 60% of Americans have taken the vaccine, 80% of seniors, that means we've actually unnecessarily vaccinated a large number of people in the United States.
Question 4, let's talk variants. Is Delta uniquely bad? Are variants getting worse? How is it possible that in September of 2021, cases were 216% higher, and deaths were 153% higher than they were in September 2020 before we started vaccinating. If you look at the first week of October, Dr. McCullough, we had 93% more cases, 97% more deaths than we did in October 2020 before we started vaccinating as well. How do we explain that kind of data?
The vaccines created a very narrow immunity in a large number of people. So the vaccines weren't targeted. When the vaccines came out, I always thought that we would have maybe 5, 10, or 20 million people vaccinated, basically nursing home residents and nursing home workers. They were the ones who needed the vaccination. There weren't any other major outbreaks. There were never any student outbreaks or major hospital outbreaks. So because the vaccines were over-applied, we basically created way too many people with the same immunity. And so that promoted the emergence of the Delta variant. We always had 6 to 12 different variants. Now we have a single dominant strain, Delta, 99% of cases, and it thrives in the vaccinated. And in 2 papers, one by Reimer-Isma, the other one by Acharian, clearly show large viral loads in Americans with Delta, similar to that to unvaccinated. And in multiple studies, Chow, Fahrenholt, Liu, all show that the Delta variant is carried and transmitted by the vaccinated. So vaccines have basically made the pandemic worse. And the Delta curve in Israel, as an example, a highly vaccinated country, is far worse than the pre-vaccination curve. The same thing is true in Iceland, Gibraltar, anywhere where vaccines have been strongly promoted, it's backfired because it creates too narrow of immunity and now has allowed Delta to thrive. Now, my experience is Delta is harder to treat and it's more infectious because it's living at far higher viral loads, particularly in the vaccinated.
All right, that brings us to question 5 then. Can you explain to our audience, for those of us that went to public school, how is it vaccines could make a virus worse? Do you see evidence of antibody-dependent enhancement within the COVID vaccines? And if so, how bad could that get, and what does that mean for the American people?
I haven't seen clinically what I would call antibody-dependent enhancement, meaning that the vaccines actually make for an individual person the infection worse. I think what the vaccines basically have done is they failed against Delta. Delta has achieved what's called antigenic escape. The Delta variant is simply not covered very well at all by the vaccines. And so that's not antigenic escape. It's basically just vaccine failure. The CDC calls it vaccine breakthrough. Either one of those terms is fine. I am concerned, though, if we keep up vaccination indiscriminately, which it looks like we're on the course for, we could invite antibody-dependent enhancement. And we're keeping tabs on this. You know, there was a story that broke a few weeks ago out of Kentucky of the R1 variant, which spread through a nursing home in fully vaccinated individuals and looked like it was lethal on the spot just about. If we start to have outbreaks like that, I think we're in trouble. And because we've, in a sense, fooled with Mother Nature, we should have never mass vaccinated right into a pandemic because there's too much prevalent disease around. And we're just inviting a new strain of the virus to be able to facilitate past the vaccines or potentially even be more virulent. It's just like putting everybody on a narrow spectrum antibiotic, Steve. We would never do that. We'd never put an entire massive population on a narrow spectrum antibiotic. We'll just allow a superbug to develop.
Finally, this is kind of a meta question to close this out, Doctor. Did what we've seen happen to the medical community, did COVID break the medical community, or were these systems and machinations already there, and COVID is kind of what we've seen here happen, kind of the result or harvest of those things? And here's why I'm asking this question, because I think it kind of gives us an idea for those of us that are helped by the medical community but serve outside of it, live outside of it. It gives us an idea of what comes next after COVID, or frankly, is there ever any next after COVID, or are we just doing some variation of this for the rest of our lives?
For the first few months, I thought the medical community was just gripped in fear. And that was the reason why they weren't treating COVID patients. They were, in a sense, waiting for the government to tell them to do something. The medical community has never been asked to respond to a mass casualty situation. And then what happened is practice patterns fell into place of not treating COVID patients, just letting them get sick at home, letting them get hospitalized, and then things became more perverse after that. In fact, there was active efforts to stop treatment of outpatients with COVID, to almost openly encourage hospitalization and to make matters worse. And families have actually taken hospitals and ICU directors and chief medical officers to court, and they've gotten court orders to force them to properly treat patients in the hospital. So we've gotten to a very perverse and distorted place in medicine. The seeds may have been sown with so many corporately employed doctors who have to follow talking orders, otherwise they lose their job. We've lost the independence of physicians. In fact, it's only independent physicians or independent-minded physicians that had the courage to treat COVID-19 and prevent hospitalization and death. And those organizations are thriving now. The Association of American Physicians and Surgeons, the Frontline Critical Care Consortium, American Frontline Doctors, Truth for Health Organization, they have building rosters of doctors who are coming off the sidelines to treat COVID-19. I think the way out of this is to drop the vaccines, drop the vaccine mandates, and have an immediate pivot to early treatment. We're on the way down out of the Delta curve. If we don't vaccinate anymore and we simply start to treat these sick patients, reduce the spread of illness, we can get this down to a low manageable level. If we keep up with this push on vaccination and fail to treat people appropriately, I think we're going to have another wave of something. Really fearful of what's next.
Dr. Peter McCullough, we don't want to take any more of your time. We know that unlike Anthony Fauci, you actually treat patients. So thank you very much for carving out some time for us today and answering our questions. Brother, God bless you for what you're doing, okay?
Okay, thanks, Steve. Go Blue.
All right, go Blue. Thank you.